and they see that it's a dual eligible, couldn't they pick up the fact that, oh, we bill Medicare first and then Medicaid? How does that work?
I want to answer that in a way that doesn't sound like I'm saying $74 million isn't a lot of money, because $74 million is a lot of money. But it's not an amount, and when you break it out among 16 CCOs and put it in the context of the amount they get monthly on Medicaid, that it would necessarily be obviously noticeable. You know, a rough analogy would be you expected your electric bill for October to be $150, and it came in at $150.74. You wouldn't look at that and automatically say, "Ooh, I need to look into that. Something is obviously wrong." In terms of data matching, I think data matching throughout the system is one of the business rigor issues that we need to get a better understanding of and improve. It is potentially the underlying root cause of one of those other problems that I mentioned, and we need to look a lot more carefully at that, whether it's on the CCO side or on our side.
Madam Chair?
Yes, Senator Steiner Hayward.
If I may, I will freely admit that prior to the end of 2016, when I became the Senate Chair of the Human Services Sub, I thought I had a reasonably good understanding of Medicaid. Not so much. And I learned a heck of a lot in the past 11 months since I took over that role. And I would tell this committee and anybody listening that there are bare minimum about 10 categories in Medicaid, and they all have different match rates, and they all have different eligibility, and the numbers that the payments that the CCOs get are lump payments. They're not necessarily broken out by categories. And as Mr. Allen said, I wouldn't want to claim that $74 million is nothing, but when you're looking at a $19 billion budget, for better or for worse, $74 million is not that much money in comparison to $19 billion. So it's hard to pick up spread across 16 CCOs and literally 1 million patients, not all of whom are dual eligibles by any means, but there may be other miscalculations that we're just not aware of because of these different match rates and different eligibility criteria. And this is one of the things that I admire about what Mr. Allen's doing, is the level of rigor and accountability that he's expecting. It's going to take a while to fix this, and we need to be cognizant of the amount of work it's going to take and patient with some uncertainty. Uncertainty is difficult, but it's absolutely guaranteed in this work right now. That $74 million is a rough guesstimate, I would argue, at this point. Is that a fair statement, Mr. Allen?
Yeah, Chairman Anderson, Senator Steiner Hayward, it's probably a little bit better than a rough guesstimate, but we are narrowing down on a better number. That does raise one other point, though, that I did want to make, which is, as I did today, one of the lessons we've taken from the last couple of weeks is I'm going to start bringing the governor's office and you information about problems that we potentially identify much, much sooner than I would ordinarily be comfortable with. I'm going to bring them to you when they're sort of faint expressions of hey, you better look at this, because I don't want to get caught out in making it look like we're trying to bury something when what we're really trying to do is scope it and identify it and quantify it and identify root causes. That really is where we were with the overpayment issue and wanting to really pin things down before we started talking publicly. I'm going to err now on the side of talking publicly much sooner, with the hopeful understanding from you all that we will bring you more details as we get them, and that may cause things to change. We may come back and say, hey, you know, that thing that I told you about last month, turns out there's not a problem there, but we want to communicate sooner and more regularly to the extent we can.